All right, let's dive in. Today we're talking about something pretty incredible, a technology that's giving surgeons, well, it's basically bionic vision, right inside a beating human heart.
35 million. Just let that number sink in for a second. That's how many adults, right now, are walking around with a leaky heart valve. It's this huge, often kind of silent health crisis happening all over the globe.
And behind a number that big, we're talking about real people, people whose lives are just drained by fatigue, who struggle for breath. And if you don't treat it, it can lead straight to heart failure. So yeah, finding a better, safer way to fix this, it's absolutely critical.
Okay, so to really get how we can fix this, we've got to zoom in on the main character in this whole story, a tiny little thing called the mitral valve. So the easiest way to think about the mitral valve is like a perfect one-way door inside your heart. It swings open, lets blood flow through, and then slams shut. Simple, right? But the problem, and it's called mitral regurgitation, is when that door gets a little faulty. It doesn't seal up tight, so with every single heartbeat, blood leaks backward. Not good. For the longest time, the only way to fix this was, well, full-on, risky open heart surgery. Now we've gotten smarter. We have less invasive ways to do it, but don't let less invasive fool you. It's definitely not easy. For the surgeons, it's been like trying to perform a delicate repair completely in the dark. You know, the evolution here has been just incredible. We went from that massive physical ordeal of open heart surgery to something called the TEER procedure. That's a mouthful. It stands for Transcatheter Edge-to-Edge Repair. Basically, surgeons can guide a tiny device through a blood vessel all the way up into the heart. Way better, right? But even TEER had this one massive challenge, and that's what sets up this next big leap. Okay, I want you to put yourself in the surgeon's shoes for a second. You're steering this tiny little clip inside a heart that's beating, constantly moving. But here's the catch. You can't see it directly. You're just looking at a bunch of flat, 2D screens. It's like watching shadows on a cave wall and trying to build this perfect 3D picture in your head. In real time. I mean, the mental gymnastics required, it's just a huge cognitive load. And this right here, this shows you the fundamental shift. It's the difference between working with those fuzzy 2D shadows versus having one crystal clear 3D map. Think about it. It's like trying to build IKEA furniture with those confusing black and white instructions versus having an app on your phone that shows you exactly where every screw goes in 3D. It's a total game changer. So the big question is, how do you get that 3D map? Well, the answer is a really cool AI-powered tool. It's called Philips DeviceGuide, and it's the tech that's making all of this a reality.
So how does this thing actually work? It's pretty smart. First, it takes the two things surgeons were already looking at, the live X-ray and the ultrasound. Then this really powerful AI algorithm just mashes them together, and in real time, it builds this super accurate 3D model. And what comes out the other end? It's nothing short of revolutionary. You get one single, clear picture of the heart, the leaky valve, and the tiny device you're using to fix it, all moving together perfectly in sync. And the impact of this is just wow. Dr. Atul Gupta from Philips described it perfectly. He said it gives physicians an extra pair of eyes, effectively bionic vision. I mean, bionic vision, that's not an exaggeration. It perfectly captures what this feels like, this incredible new level of clarity and confidence in the operating room. Okay, so bionic vision sounds cool, but what does it actually mean when you're in the middle of a procedure? Let's break down what this means for the doctors and, of course, for the patient on the table. Well, the benefits just kind of snowball. When you can see better, you can navigate better, right? So procedures get safer. It also makes it way easier for new surgeons to get up to speed, which is huge. That means more hospitals can start offering this kind of advanced care. And for the patient, it means the whole thing is smoother, faster, and the outcome is way more predictable. And what I find really cool is how these benefits ripple out to everyone involved. I mean, obviously, the patient comes first. Lower risk, faster recovery, the whole deal. But the surgeons feel it too. They have more confidence, less stress. And that lets hospitals say yes to more of these complex procedures, helping more people than ever before. And really, this is the bottom line. This is why all of this matters so much. We're talking about giving a life-saving option to people who, just a few years ago, would have been considered too old, too sick, or just too fragile for surgery. This tech literally opens a door for them. It takes something that was incredibly high risk and turns it into something treatable. It gives them a real shot at getting back to a full, active life.
All right, let's zoom out for a second because this is bigger than just one cool device for one specific surgery. What we're seeing here is a little preview of a massive shift that's starting to happen across the entire field of medicine.
The best way to think about this is like an airplane cockpit. The surgeon, they're the expert pilot. They've got the years of training, the skill, the experience. They're in charge. But the AI, that's the essential co-pilot. It's constantly feeding the pilot critical real-time data, monitoring all the systems, and putting up this clear, easy-to-read map. The key is, it's not replacing the pilot. It's making the pilot even better. It's enhancing that human expertise.
And believe me, this pilot/co-pilot model is just getting started. Right now, it's for this specific heart valve repair, but in the very near future, you can bet we're going to see it used for other kinds of structural heart repairs. And if you look out, say, a decade from now, this kind of AI co-pilot could just be a standard piece of equipment in all sorts of different operating rooms.
So that leaves us with this one big, fascinating question to think about. Just imagine, what becomes possible when every surgeon anywhere in the world has a co-pilot like this? When they can all walk into the most complex procedures with this level of confidence, this level of precision? The potential is, well, it's going to transform everything.